Feels like nobody else will understand or can understand or cares. It's just that feeling just alone, completely alone.
Gaynor Spence hasn't lived through lockdown. She's survived it. Isolation made her existing depression so bad, a few weeks ago, she planned to kill herself.
It grows worse because you don't tell anybody and you don't speak to anybody at first. So that's how it grows into them feelings of no one's going to miss you. No one would even know. You feel like that no one would even know if you were gone. And it would just stop the pain of feeling so down and so alone. And it progresses onto them feelings of there's no point in being here.
Gaynor was able to get help.
So when you say you're feeling down...
And whilst there is still no hard data on how lockdown has affected suicide rates, calls to this suicide prevention charity have tripled.
We were already in a complete crisis before COVID happened. Services are so stretched and unable to keep up with the demand, and waiting lists are so high, hence why a service like ours is needed. And I'm very concerned about what happens during coronavirus and following coronavirus when that demand is only going to go up and up and up for a significant period of time.
Public Health England is doing a huge campaign to reach
Mental health services say they need more funding. The government knows it's an issue, with public health campaigns to reach the vulnerable already underway.
more prone to existing.
But the future does look worrying, especially in areas like Blackpool, which will be hard hit by this pandemic's economic fallout.
In the 2008 financial crisis, we showed that that led to about 1,000 more suicides in England than would have been expected. And it was particularly those areas that were worst hit by increases in unemployment. But those things are not inevitable. The mental health effects of recession tend to be less severe in those countries that have invested more in supporting people when they're out of work.
That means a combination of welfare and mental health support. And when there is help, there is hope.
I know at the time you feel you just want to sit there and you don't want to tell anybody how you're feeling. But don't think you're alone, just reach out and don't feel ashamed, even if you're reaching out to a stranger.
Caterina Vitozzi, Sky News.